Hi.
Hello, everybody. My name is Ken Abrams. At Deloitte, I serve as the firm's Chief Medical Officer.
Good afternoon, everybody, and thanks for taking the time to spend with us again today. I get the privilege of hosting today's discussion, where we'll talk a little bit about virtual health and specifically focus on some of the concepts around the ability to deliver hospital-level care at home. I am a physician. I'm an anesthesia critical care doc by training, and then I joined Deloitte 9 years ago now. I'm Deloitte's Chief Medical Officer for the U.S., and have the privilege of working with a group of about 65 physicians, clinicians, and scientists in the firm as we serve clients in lots of different ways across life science and healthcare. I'd love to get your perspectives on what you see as the things that are going to either help continue to accelerate and advance the adoption and use and value associated with virtual health and telemedicine, and what things are going to be limitations and barriers that we still need to overcome.
We, from the point of entry of patients into a facility, we are asking them to be their own advocate and their own historian. Well, what if they don't speak English? Translation could be an issue or is an issue. Another one is documentation. And I mean, whether it be a paper chart or an electronic health record, you can bring a horse to water, but you can't make them drink. Like, it's that compliance of, we are so busy in healthcare. Do we even have time to now document what just happened? And of course, we're relying on that documentation as data. One that kind of ties the two together is the transition of care. So I know, Ellen, you kind of talked about it. It's that community to acute, acute to community, acute to rehab. It's that void that we have where all that information gets lost. I mean, we do it really well in something like medication reconciliation, where you can find out what the patient had been taking at home and then have it ordered in the hospital. That's somewhat easy. Where it becomes a little muddled is something like goals of care, a conversation that no one really wants to have with a patient, or what is your plan of action?
I'd be so interested in seeing what ideas they would have for the future of virtual pregnancy, visits. It's like, do you want to hold the doctor up to your belly so they can see the size, or would you have to measure it? It's really interesting, or have a certain, you don't want to put your phone to your belly, but I know they have a lot of those heartbeat checking apps, and they're like, oh, turn airplane mode off. And I'm like, is that really helping that much? I don't know. I don't know about the waves of all of those things, but it'd be really interesting to see what they might have in a year from now if they're still doing virtual stuff. So I know that's a lot of questions that I receive daily. Like, are you going to the doctor? What are you doing?
I do want to thank everybody for participating today. This has been a really engaging and stimulating conversation. I have learned a ton from all of you, so thank you for sharing your thoughts and participating. We really do appreciate it.
Thank you, everyone.
Thank you, everybody. Have a wonderful week.
Stay well, everybody.
Stay well.
Thanks a lot for moderating. Take care.